This patient education video is one in a series brought to you by the American Academy of Allergy, Asthma, and Immunology, and sponsored through an unrestricted educational grant from UCB Pharma.
So how are you doing? You seem to be feeling better.
I'm feeling great.
God, it's nice to be outdoors again.
Yeah, I know. It's hard to believe. A couple years ago, we couldn't have even done this.
I'm so glad you got those allergy shots. Yeah. It really seems to have made a big difference.
Yeah, it has. If we would have tried this before, my eyes would have got all itchy and my sinuses would have swollen up. And on those really bad days, I would have got an asthma attack. And I'm just glad to be able to get outside again.
I'm glad we can get outside again.
For many people with allergies, it often seems like nothing can get rid of their symptoms. You've taken your medications, tried to avoid the things that trigger your symptoms, but nothing seems to help. Well, how would you feel if someone suggested injecting those allergens you react to directly into your body?
Chances are you'd think it was a joke, but instead of laughing, many people are breathing a sigh of relief. That's because this treatment, known as immunotherapy or allergy shots, has helped thousands of people with allergies and asthma.
It's a long-term treatment plan that could help control your symptoms, reduce the need for medications, and help you lead a more normal life.
Immunotherapy is helpful for treating people who suffer symptoms from allergic reactions. This includes reactions that prevent you from completing normal day-to-day activities, or life-threatening reactions that cause breathing difficulties. So how do you know if allergy shots are right for you?
There are individuals who have to be allergic. Their symptoms should correlate with what they're allergic to. They should have gone through a period of trying to avoid those particular allergens in their environment and have gone through medications that are standard medications and yet do not seem to be controlling their symptoms.
Your doctor will start out by asking you questions about you and your family's medical history, the environment you live and work in, and of course, your symptoms. Next, a physical exam tells the doctor how your body is producing your symptoms. It can also reveal any underlying problems. Blood tests measure the level of certain allergy-related substances in your body. Those levels help determine how severe your condition is. Finally, a skin test can be performed. A skin test involves injecting a small sample of a suspected allergen into your skin. If a reaction occurs, a welt or hive will appear after about 10 minutes. The size of the welt will determine how sensitive you are to that particular substance. These tests will help your allergist determine which substances you're allergic to and if allergy shots are right for you.
So how do allergy shots work?
When you receive an allergy shot, a small amount of the substance you're allergic to is injected into your body to build up your body's resistance to your allergens. Over time, your body will respond less to your allergens, lessening your symptoms and reducing the need for medications to make you feel better. When you first start out, you'll receive an allergy shot once, possibly twice a week. After you receive your shot, you'll be asked to sit and wait 15 to 20 minutes. This is to ensure you do not have a reaction to the injection. Reactions can range from a slight swelling of the area to a feeling of your chest tightening to more general symptoms. Be sure to contact the nurse if you have any difficulty at all, and then make sure to tell your allergist. The level of allergen extract injected will increase with each weekly visit until you reach your maintenance or therapeutic dose. This is the largest, most effective dose your body should receive. Reaching this level can take up to 12 months of regular treatment. Once you reach your maintenance dose, you'll usually only need to receive your shot once every 3 to 4 weeks.
But what about normal exposure to allergens? Say you're allergic to a cat. Wouldn't normal day-to-day exposure to the cat build up your body's resistance to it?
The first thing that we see is that the route of exposure is different. We would possibly handle a cat, touch our nose, touch our eyes, and have exposure by that route. We may inhale cat allergen that is suspended in the environment, in the air, and get that down into our lungs and into our nose and again into our eyes. Injecting this is clearly a different route, and in fact your immune response may be significantly different depending upon the route of exposure. The second is we have no control over the amount of exposure in the home. Allergen immunotherapy is very, very controlled exposure, and route exposure is the route that is taken is also very controlled. So it makes a significant difference in terms of building up a tolerance to these allergens in the environment.
Keep in mind that allergy shots are not a quick fix. First of all, depending on the type of allergies that you have, it may take several months before you notice an improvement in your symptoms. Secondly, patients usually receive allergy shots for about 3 years before good long-term results are seen, and you're reevaluated for discontinuing them. And finally, for this treatment to work, it is very important to go to your appointments on a regular basis. While medications help control your allergic symptoms, allergy shots are the only available treatment that can actually change the way your body responds to allergens.
You can be immunized against outdoor allergens such as pollen from trees and grasses, from mold, and from ragweed. Indoors you can be immunized against dust mites, mold, and animal dander. Immunotherapy can also be useful for people who have severe reactions to insect stings. A treatment called venom immunotherapy helps those people build resistance to the insect sting. It's 97% effective in preventing future reactions.
Both types of immunotherapy are designed to allow people to enjoy life again and engage in normal day-to-day activities without having to suffer.
It's very clear for the patients who have allergic disease of the nose and of the lungs, such as asthma and allergic rhinitis, that the three-tiered approach of allergen avoidance, medications, and immunotherapy will return individuals to a very good quality of life. This following of a plan mapped out by their allergist of these three steps is going to improve the health and well-being of these individuals, allow them to function much better in their daily activities than they were able to before.
You should remember that as a patient, you have some responsibility for your own treatment. Practicing avoidance measures, taking medications as prescribed, and showing up regularly for your allergy shots are all your responsibility. By working together with your allergist, you can manage your allergies. It's the best shot you have.
For more information, please call the American Academy of Allergy, Asthma, and Immunology at 1-800-822-2762. Or visit our website at www.aaai.org.